I had covered a lot of information in that last video, and it just felt time for a break. I don't know about you, but I felt ready for one. So I want to pick up again with the epiphyseal plates. The epiphyseal plates are made of hyaline cartilage. They're at the ends of long bones, and they go through mitosis, so you get more cartilage at the end of the bone. But then osteoblasts come in and ossify that part of the bone. And so as long as you're growing, you'll still have a hyaline cartilage chunk there. But then after you're done growing, even that part will ossify with it'll look a little bit like a scar on there. So then it's called, let's see, where did my purple pen go? Sorry. Okay, so after puberty, or maybe I should say after adolescence, because a lot of people still keep growing after they've gone through puberty. So after adolescence, the amount of growth hormone, so use orange here, because I'm telling you about another hormone, growth hormone. And that comes from your brain, from your pituitary gland. Growth hormone will decrease, and the hyaline plates, or the epiphyseal plates, will ossify. It's called fusing. They'll fuse. So that's a hormone. Now go back to your purple pen. And then it's called an epiphyseal line. And so a forensic a scientist can look at a bone and estimate the age of the person if they were an adult or if they were still growing, based on if the epiphyseal plate had fused or not. So it can be a good clue as to the age of the person that's being studied. The difference, here's what can get tricky though, depending on the level of nutrition that someone has and the overall health that they are experiencing, their epiphyseal plates may fuse at a younger age or an older age. And also there are some differences just amongst where people live on the earth and sun exposure even, because vitamin D is important. So there's always going to be estimation going on here, especially if we're looking at the bones of people that lived thousands of years ago. They may have had their epiphyseal plates fused when they were 10, and maybe people today it's like 18 or 19. So it really, there are many variables that need to be taken into consideration when estimating the age of a skeleton. So if someone experiences trauma, then the plate might fuse early. And when I say, so trauma or malnutrition can cause the plate to fuse early. So if growth hormone drops and the epiphyseal plates then fuse, it should make sense that growth hormone is the hormone that stimulates the lengthening. From the pituitary gland. Stimulates length being added to the bone. Okay, then let's just put a couple of names on here. The ends of the bones are called the epiphyses. And if it's the one that's closest to the torso, we call it the proximal epiphysis. And if it's the one farther, so that says proximal epiphysis. And if it's the one that is farther away, then it's called the distal epiphysis. And then the shaft of the bone is called the diaphysis. That's the shaft. Just a couple more things that I want to make sure I add on here. I'm going to put the rest of our notes at the top of this page because we have a little bit of room left up here. This extension of the periosteum is called the joint capsule at this point. So if someone needs to have very invasive surgery done to their joint, then this joint capsule would have to be cut open. Okay, now I want to wrap this page up with a description of what is found in bone matrix. So if you're looking at a piece of bone, there are going to be cells called osteocytes, and there is going to be matrix that the osteocytes were responsible for putting down. And the matrix is composed of two types of substances. It's going to have lots of calcium salts. And that's why we always talk about how calcium is really important for bone health. And it's going to have lots of collagen fibers. Now, which of these do you think is stronger? If you guessed calcium salts, you're right. Calcium salts are inorganic, kind of like a rock, and they are responsible for the great strength of a bone. However, they are brittle. Think about a rock. You can throw it on the ground and it might shatter. Well, thankfully our bones don't do that. And that's because they also have a flexible organic component that gives a little bit of flexibility to a bone. Especially kids' bones, which have more collagen, relatively speaking, are very flexible. So if a person is born with a mutation, this is a true disease called brittle bone disease, and they don't have enough collagen fibers in their bone, then their bones could be brittle. So let's use a different color pen. How about a red pen? And say over here, so not enough collagen, then that could result in brittle bone disease. And then what about the other? If there's not enough calcium, then there actually start to be visible holes in the bone. The bone becomes too porous. We call that osteoporosis. And a precursor to that is osteopenia, which just means not enough bone. So osteopenia, and then once it's full-fledged, it's osteoporosis. If this happens in a child and they don't have enough calcium in their diet or not enough vitamin D to absorb the calcium, then they can actually get rickets. So in childhood, lack of calcium either in the diet or ability or lack of vitamin D, which is needed to absorb the calcium. If that happens, then the child's legs might bow out from the weight of their body, and that would be what we call rickets.